Yeah, we're live. You can start.
Yeah. Warm greetings, everyone. I would like to welcome you all to the last event of MedInvade 2021, a virtual healthcare conference organized by Squad Medicine and Research. As a cherry on the top of the cake, the research unit of Clinicis SN has organized an exclusive panel discussion as the last event in MedInvade 2021. The topic of the discussion will be the current trends of medical research in India and undergraduate perspective. Today we have with us the guest speaker for this panel discussion, Dr. Vivekanand Jasar, the Executive Director of George Institute for Global Health, India, past President, International Society of Nephrology, Chair of Global Kidney Health, Faculty of Medicine, Imperial College of London. Sir has played a key role and associated with various organizations like Indian Society of Nephrology, International Society of Nephrology, Transplantation Society, Asian Pacific Society of Nephrology, and Asian Forum of Chronic Kidney Disease and Initiative. Sir has also been a part of national and international reputed journals, namely Indian Journal of Nephrology, which is an official journal of Asia Pacific Society of Nephrology, American Journal of Kidney Diseases, and American Journal of Transplantation. Also, Cochrane Renal Group and advisory boards of several other journal and Oxford textbook of nephrology. So we are glad to have you on the board. Thank you. We have as a panelist Dr. Ashok K. Shamsar, who is working as Associate Professor and Head of Academic Research, Sancheti Institute for Orthopaedic and Rehabilitation, Pune. Sir is a founder of Ortho TV and many other medical TVs like Anesthesia TV, etc. Sir is the editor of various journals related to orthopedics, and Sir has more than 250 publications under his name. Also, we have with us Dr. Vishakha Modak, who has completed her internship from Rajarajeshwari Medical College and Hospital, Bangalore, and is currently posted in Bangalore Medical College and Research Institute as a junior doctor. She has got more than 3 publications under her name and is currently working on 2 upcoming publications. We also have with us Oshin Puri, who is a third-year medical student from AIIMS Rishikesh. He is the chief editor of Journal of Asian Medical Student Association, which is an international index student-led journal and also reviews various other journals too. He has also got 2 AMEE student initiative grants among various achievements. We are glad to have all the panelists with us today here. Without any further ado, I would like to ask Fauzia to take over, who will be monitoring this discussion from now on. Thank you.
Thank you so much, Srinidhi. Hello and good evening to all the respected panelists present here. It is an honor to have everyone on board. I am Fauzia Sheikh, the moderator of today's panel discussion and the Senior Research Executive of Clinicis SN. So as we all know, today's panel discussion is about the current trends of medical research in India and undergraduate perspective. Starting with the questions. So the quality of research in India is deteriorating. Tons of low quality research is being produced in medical colleges as it is a criteria for promotion. I would request Dr. Ashok to please add his valuable views towards this concern.
Yeah, thank you very much for inviting me to this panel, and it's a pleasure to interact with all panelists and the undergraduate students here. So the question is quite relevant in last 6-7 years when the MCI made it mandatory for the seniors, professors for promotion. They need to have a specific number of publication as well as they need to be in a particular order in the authors list. So this was like a decision which was very, very abrupt, and there was no preparation or groundwork provided to the professors and the seniors for conducting research as well as training about it. So the problem began there. There was lack of infrastructure and there was lack of training or say, inclination towards research amongst the professor who were supposed to do this kind of publications and have produce these kinds of papers. So what it led to is a flurry of publications which were of low quality from various institutes, because like it was a government prerogative and they have to fulfill it. So they didn't have much choice. But it also led to a lot of other things. Okay. So for example, it led to development of a lot of predatory journals all across, which were just printing whatever you send to them without even reading what is being published, and they just ask you to pay a certain amount of money and get it published. So that came as a real surprise even to me, who was in this field of publishing for last 12 years. There were so many publications and so many publication houses that cropped up almost within a year's time, and all these journals were just asking for money, and people were publishing in those journals, because earlier the indexing requirement for journals were quite liberal. So there were a lot of predatory journals which got indexed according to MCI rules, and people got published with low quality publications. There were a lot of misconduct also. So, like I was reviewing for almost 12 journals, which from national to state level, and we found that there was a lot of misconduct. There were a lot of data manipulation that was happening. People had done studies on 30 patients and shown as 200 patients. Things like that were becoming prevalent for just for the sake of getting published. So this was a really, really, like you clearly mentioned, that ton of low quality, not only publication, but misconduct was also promoted during this period. Since last year, I think the situation has improved with the new guidelines from MCI, and I feel that it is getting better. But the interim period was really not. I mean, the point again is there is a silver lining, because not only the quantity of research improved, but over a period of time, the quality improved definitely. So people who were not publishing at all, they started publishing lower quality material. But over last 2 years or 1.5 years, the same people, once they got acquainted to the research paradigm or the research culture, started producing better articles. So, I'm not saying it's completely wrong. There was a byproduct of that particular scenario which led to slightly better. We are much better than what we were uh, before the government mandate came in. So that is there. Another issue with this, with the thing with the government mandate that came, it actually devalued certain studies. For example, case reports, letter to editors. These kinds of studies were not even considered for promotion. So I feel all kinds of studies should be included when we are talking about research, because everything has its own weightage and value. So it created in minds of researchers that okay, there are certain studies that are valuable and certain studies are not valuable. So that's again a kind of drawback that we got from this particular scenario. So yes, I agree with you that there was a flurry of this low quality research, but I also see a trend towards getting better. The same researchers now are looking at producing better and better studies, and I'm really happy and glad that this is happening across. Yeah,
Thank you
that's
so
my
much.
point of view.
Okay, thank you so much, sir. I would request Dr. Vivekanand to please add to this.
So thanks. Thank you, first of all, for inviting me and asking me to speak to the students. I think one of the best things that any teacher can do is to have a consistent and a regular and stimulating dialogue with the students, because it is not only for the benefit of students, but also helps the teachers. because the teachers also are lifelong students. No teacher can be a good teacher unless he or she is also a student. And as a wise man said, that as the teachers get older, as I get older, my teachers get younger. And so everyone who is on the other side of this listening as a student is also a teacher. So this is relevant to all of us. So that's number one. And the essence of research is having a debate, open debate, asking questions and trying to find an answer together. So I would like to make just a few essential points from my point of view. In terms of research, often, and as has been framed in the last 10 minutes or so, is why are we talking about research and why should physicians or clinicians care about research? The way it is being framed is that because it is essential for promotion or appointments. I think that's the wrong way of looking at it. Research is an essential part of development of medicine for provision of good clinical care and for advancement of knowledge. That's really what it is. Now, during this process, a number of things happen. Of course, the foremost goal of research is generating new knowledge, advancing the frontiers of science, advancing the frontiers of clinical care. Publication of papers is an essential component of the entire research enterprise. And that will happen if you do research. So the point I'm trying to make is that the goal is not to publish research papers. The goal is to do research and to accumulate knowledge, evidence, and share it with the rest of the world. And that sharing takes place through academic publications. It takes place through presentations in conferences, but also equally important it is for us to remember that the main consumers of our research are the people, to whom our work is directed. So we also need to get better at communicating what we do to the end consumers, which are members of the general public, other organizations, and our students as well, because not necessarily all of the students will read all the journals where this work gets published. So our job or our responsibility as a group of researchers is broad. The next question is, it is also important for us to stay as important stakeholders, is to spread the message of importance of research beyond just publication to the general public and to all the stakeholders. So why should the general public care about medical research? Even if they are not doctors, even if they're just consumers, but we have to all remember and we have to impress it upon everyone we meet that all of us are potential consumers of the healthcare system. Every single person, right? Everyone, there will be a childbirth in every household. People will require cataract surgery. So something that will happen to everyone just as a matter of course. People will require routine care. They will need their blood pressures checked. They will need to have some mandatory health checks as part of their employment process and insurance process and so on. So you will come in contact with healthcare system. People will have some illnesses, even if there are minor trivial illnesses, they will go to doctors for treatment. And it's been now well established that if you go to a organization, enterprise, institution that has a culture of research, you are likely to get better care in that particular organization compared to another one that does not have a culture of research. So it is essential for us as developing clinicians, developing physicians, to have amongst us a general culture of research so that we embed research in our daily practice, because it improves the way we treat our patients. It gives us the ability to appraise knowledge in a proper way, to kind of differentiate what is knowledge and evidence-based to that for which the evidence is poor, how to make a decision that is based on judgment. That's very important. I would like to differentiate here the difference between judgment and opinion or experience. Opinion is different from judgment. So when you make a decision based on judgment, it means that you are taking into account whatever evidence is available to you and judging it. You have the ability to judge it, and then you come to a conclusion. Opinion can be non-judgmental also. It is, we do something just because we like it. So that's a difference. And so in the end, I would like to say that practicing evidence-based medicine, which is grounded in research, not only improves the quality of care, but it also reduces cost of care. Because every time we provide good quality care that results in optimal outcome, we maximize the value of our money. We could be spending a lot of money on investigations, on treatments that doesn't provide good clinical outcomes. That is wasted money, and that is why it is called low value care. As physicians or as conscientious ethical physicians, we all the time, we want to reduce the amount of low value care that we provide. So there are a number of stakeholders in this. The reason that the MCI has to make these regulations about the number of publications, etc., is because our medical enterprise had turned away from the culture of research, and even to get that basic basic list of parameters that would be used to judge someone's worthiness or suitability for appointment or promotions, the MCI has to bring in the minimum set of rules. Please remember that though they are the minimum set of rules, right? And what we need to do as good quality researchers is always to not strive for the minimum, but strive for the optimum and the best that we can, right? It's really great to see, and Dr. Shyam is absolutely right, that as we do more and more of this, we will get better at it. There is no doubt about the quality of researchers or the quality of research that Indian medical professionals are capable of. Indian medical professionals, if they are given the appropriate enabling environment, they produce very high quality research, which is evident from the publications that you can see from other countries. And you can you can look at the list of authors, and you will see that it is a fair number of these high quality publications have authors whose names you can identify as being of either Indian origin or South Asian origin and so on. So it is not that there is any problem with the ability of our students, our medical professionals, our graduates in being able to bring out these such outputs, but somehow we have to see as a community, how can we produce a situation where they can do it optimally? So I'll stop here, and I think this needs to happen right from the early stage. So that is why I'm particularly glad by this meeting, because this is a meeting of medical students, and this is the right place where it needs to happen. Because the more we delay this, the less likely it is that someone will find it worthy of their time. Because the earlier you get it, it gets into your culture, it gets into your DNA, and you are always, it becomes your default mode of thinking. And there is nothing which is more effective than changing one's default mode of thinking. And one's default mode of thinking, the moment it becomes research oriented, you are on a winning path.
Thank you so much, sir. The next question would be, data collection plays a very crucial role in research. I would request Mr. Oshin to talk about inconsistent and incomplete data maintenance and lack of data transparency.
Thank you, Fawzia, for the question. Since that's my first question, I would first take the opportunity of thanking Squad Medicine and Research and Clinicals for having me here with such esteemed panelists today. And it's a pleasure for me to give my opinions along with them. I'll try to keep it short. As far as data is concerned, something from more of the recent times is that undergraduates have started focusing on surveys, and they think that making a Google form and collecting responses is how research works. But it is not that way. Questions need to be validated. Surveys need to be piloted before they're sent out. And for that, they need a directed understanding and teaching about research, which is somewhere or the other lacking in the Indian scenario. So in the process of trying to mimic what others are doing, they land up doing anything and everything. And that is what is and not there is no proper maintenance. Now, another aspect in this is that when an undergraduate starts doing a survey, they would simply spread the questionnaire at whatever groups they know. Then they would get certain data. They would make out certain tables out of it in Excel. And as and when a conference would come, they would send an abstract to there. They won't understand the purpose of defining the time frame of research, that from when it should start and when it should stop. Abstracts are not written in between until and unless we formally go on writing an interim report. So these are few things that really need to be taught. They can't come by, by ourselves. And once this is taught, it would surely improve the way undergraduate students collect data and maintain it. And then coming to the last part of this question about data transparency. So this is a well-known fact that every researcher tries to keep his or her data to himself as much as possible. Primarily due to the fact that even after the publication is done, there is something known as post-hoc analysis, which many researchers would want to do, or they would get another statistician on board who can do a post-hoc analysis and we can find out multiple publications out of it. But then this limitation that journals won't ask for your whole data set has given a liberty to many other people. As Sir pointed out, that people would do a study on 30 people and then they would say that it is done on 200 people. Why? Because the journal can't ask for the whole data set, right? So I think that regarding data transparency, it's a risk-benefit ratio, whether something like, data transparency should be used or not, because it puts to stake the effort of a researcher who might be able to find out multiple results from his data through post-hoc analysis. So yeah, data transparency is a debatable issue from my opinion. I'll pass it back to Fawzia for the next part. That is what I think of this question.
Thank you so much, Oshin. I would really request Dr. Vivek to take over the question.
So thank you for asking this question. This is a very important one. As we all know, that eventually all research enterprises will lead to generation of data. And data is critical, and we have to be very respectful of the way we collect data. So what I'm going to do is to step back a little bit and talk about the process of data, even thinking about data. So we need to start thinking about what will be the structure of the data from the time we formulate the research question. That's important. What kind of data will be important for you or us to be answering the question that we have in mind? It requires careful thought, development of a protocol. You can have data of multiple types, but the two main broad types of data that we generate are qualitative data and quantitative data. Most of the time, we think of quantitative data in our research projects. Some numbers for everything, whether it is age, gender, whatever parameter you are measuring. So most of the time we think of quantitative data. So it's really important for us to think very carefully about the data points that we want to be collecting. Whereas you want to be as complete as possible in the amount of data that you collect, you also don't want to over-collect data, because data collection is also an onerous, time-consuming, and costly process. The more data you try to collect, the more there are chances of errors coming in. So please don't collect data that you don't think are useful to your research question and will never be used. So don't collect data for the sake of data collection, right? Having said that, I think it's important that we keep in mind when we are embarking on the process of undertaking a research project, that we should also anticipate what can be the future research questions that can be asked for that particular topic. And if you can collect some data that you may not use right away, but will be useful for asking some follow-up questions, I think it's important that you do collect that those data sets. Data management and data administration is also important. So just taking, going a little bit further from what Oshin was saying, is that you need to set up a group of people or a committee that will monitor how you are collecting the data and how you're going to use the data ideally. It may not be needed in every single project. If it's a small project, you don't need it, but even if you are managing the data by yourself, you need to have at least a set of principles that you should agree on beforehand, right? And those data, so how will those data be shared? And now jumping on to, of course, the data do belong primarily to the researcher or the group of researchers that generate those data points. And they should have all the flexibility and ability to use it and publish it in the way they see appropriate fit and so on. But now do be aware that there is a growing movement of transparency of data around the world. And nowadays, some journals will require that you make your data available in a transparent manner in some public database, or you should commit to making those data available to other researchers should they require to use it for a legitimate purpose. And what you can do is that if you have a committee that is mandating that data, you can say that all requests for data should be submitted to this committee, and the committee will evaluate and make a decision whether the data sharing is appropriate or not. In some instances, you do need to protect your data because it leads to generation of new intellectual property. And again, in that case, there are guidances available on how you can do that. But I think generally having a policy, this is not necessarily for individual researchers, but for organizations that engage in research in a systematic way. All of those organizations need to have a data sharing and data management policy, in-house policy, because it helps not only the individual researchers, because they might be asked these questions repeatedly, and each individual shouldn't have to try to find an answer by himself or herself, but should have someone in the organization to come up with an answer for them that can be used. And also it helps, having an institutional policy is something that you can always refer to when you are faced with these kind of questions.
Okay, so thank you so much for such a beautiful insight. I believe all the students and research enthusiasts that are hearing this will find it very beneficial for a very long run. Thank you so much. The next question is, research is not only about data collection and literature review, but we also need to maintain the right attitude, but there's a lack of right attitude and motivation to conduct research. I would request Dr. Vishakha to speak on this, please. Thank you.
First of all, I'd like to thank the SMR team and even the Clinicase team for conducting such a wonderful, panel discussion on this. So I would now take over from you towards the question. So the right attitude towards research, I think this is such a multi-layered problem. And it's because, like Dr. Vivek said, that research should be integrated. The right attitude towards research should be integrated in our education system from the very beginning. And if you see countries like USA and the UK, research is a very important and integral part of their education system. Like, students are given assignments and the attitude towards research is developed, which I feel is lacking in India. Like, we do not have any orientation towards conducting a research study from our undergraduate level. Like, I have seen postgraduates conduct research for their third year dissertation or thesis, but at the undergraduate level, there is no orientation which is given. So very few students who are enthusiastic or self-driven, try to find their way through, like searching, and they don't have a proper structured and orientation since the beginning for the conduction of research. One more thing is that it's a two-way problem. Like, since students feel that they do not have guides that they can approach, but I have also spoken to a lot of guides and professors who are enthusiastic about research, and their complaint is that most students want to conduct research for examinations abroad to up their CV, like for the purpose of USMLE or PLAB, but the attitude is lacking. So they are very inconsistent. Like, they are initially very enthusiastic about conducting the research, but then they don't understand that research is a long process. It is not something that can get over within a week or 2 weeks. So it should be, I think, included as a part of our curriculum. And the guides must also see equal reciprocation from the students' end, equal consistency and motivation to carry it. One more thing is the lack of funding. So most institutions abroad have a special cell or department and special funds directed towards research. But in India, unless it's a very big centralized institute, most private institutions or colleges do not have a separate funding for research, and this can be very demotivating. Like, I have one paper which is still pending purely because of the lack of funds. So it's a multi-layered issue, and unless we change the curriculum and unless we start developing the right attitude from the beginning, I think this problem will be prevalent. Thank you.
Thank you so much, Dr. Vishakha. So as Dr. Vishakha spoke about funds, so funds play a crucial role in all research, but there's a brain drain of quality researchers due to lack of funds and opportunities. I would like Dr. Vishakha and Dr. Ashok to please emphasize on the same. Thank you.
So can I?
Yeah, go ahead, Vishakha.
Okay, so I think about funding, the first time that any undergraduate gets exposed to the field of research, from my personal experience, is when this ICMR project is announced. Like, everyone thinks ICMR is like the end all be all to conduct research from a purely undergraduate perspective, because we aren't exposed to other methods to conduct research. So, it's very demotivating if your project does not get ICMR approval, and hence you don't get the grant for conducting the research. And also, as I previously mentioned, there is a lack of funds directed in any institute towards research. So unless these two issues are addressed, I think it can add to the brain drain, as you said.
Great. So, okay, so the question is about brain drain due to lack of funding. I think it doesn't happen. People don't go abroad just because they are not getting opportunity to do research here. It's an overall package. It's not only brain, but skill drain also. So even now, none of you guys are going to go abroad because you want to do research. You want to do clinical practice, and you're getting a complete package, including research into it. And that's the reason why you're going. You're not going because you don't have funds for research here in India. So, I mean, that's kind of the question is not rightly framed. So, lack of funding exists in India, but what Sir was saying earlier about the culture. Once you see the entire research culture, you'll find that there's so much that can be done with so less of funding. Okay, so once you start taking those small steps, like somebody mentioned surveys, so what you need is a very basic minimal infrastructure to do that kind of research, not much of funding. So try and initiate your things based on the lowest funding cost. Once you initiate with the lower funding cost, you might get takers. For example, even now, academic societies in India, I know the Maharashtra Orthopaedic Society, the Indian Orthopaedic Association, they are all ready to fund certain amount for research projects, and they are funding. Okay, so probably these associations are also a target for approaching for funds, not only ICM. So what you need to do is explore the research designs which can be more impactful with lower funding, and then also explore the funding opportunities from academic bodies, not only the government bodies but also the NGOs and the other areas. And I'm sure you'll get funding even from ICMRE. If you present a project, you'll get properly reviewed, and after the review process you'll get whatever reply they'll give you. But if you start with other projects and start building your research value or research profile, that will help you get funding from higher government bodies easily over a period of time. If you are a novice, you want the funding for a survey to be done, I'm sure you'll face difficulties. So it is. So again, our problem is lack of mentors, how to go about doing those, where to find the fundings, and how to make a funding or a grant application really for us in India to project to certain bodies or certain associations. So I think funding opportunities are there. We just need a proper channel to go through and proper guidance on how to approach it. Again, one more point that Vivek sir made was about the culture of research in India and the brain drain part. So we have to move from achievement based thinking to an impact based thinking. So we need to look at our uh, research papers or publication or projects not only as achievements but as impact towards patient care. Okay, once you start thinking in that manner, okay, how will my research impact patient care or uh, impact the knowledge or enrich the knowledge? Then you'll start going in that way. It need not be. I mean, of course, it is an achievement, and of course, you get promoted. So that's a add-on. But you don't do research just because it is you marked it as an achievement amongst your peers or get a promotion. I mean, promotion is mostly only for people in government sector, the private sector, which is publishing more quality research, at least in orthopedics. So at least in orthopedics, I can tell you that more quality research is being published by private sector rather than government bodies, by the government institutes. So they don't have any issue of promotions or anything like that. But again, it is mostly achievement based because they want to look at as being achieving something uh, in views in eyes of their peers and in society and things like that. So that's another currency to talk about. But once you move from achievement and look at your research as an impact based thing, then I think that will be more useful and it will help you design simpler studies. Okay, we need very, very simple studies to go about. Um, I mean, even the demographic data for most of the things, at least in orthopedics, is lacking for us. So we have no clue about demography of hip fractures in Mumbai city, for example. Just the demography details is not available. There is just one research study that is done in Chandigarh, which is poorly done on this kind of data. So we just need very, very simple studies to go about, and these simpler studies don't need much of funding. Again, the funding is available with various bodies, not only ICMR. So you can approach to funding to any academic body, whether that funding is there in their uh, description or not. Just approach them, tell them this is what we are doing, and will you like to fund it? And to your surprise, they will be ready to support you. So that's my take on it. I don't think there is a brain drain because of lack of funding. So that's it.
Okay, sir. Thank you so much. I would request Mr. Oshin to add to this question from a student's perspective. Thank you.
Thank you.
I think we might have lost Mr. Oshin.
Yes, I guess there's some connectivity issue. We'll wait for the next 20 seconds and then we can move ahead.
Yeah, please go because we are lacking time.
Yes. Okay, so coming to the next question, the problem of disconnected private sector persists in India when we talk about research, and there is clearly a need of integration for the same. I would like Dr. Ashok to talk on this.
Yeah. So, like I was saying earlier, for any research, even in the Western world, there are three pillars. Okay, so we have the private sector, we have the government, and then we have the research institute or the researchers. So all three together will produce wholesome research which caters to the need of the populace that is in the country or in that geographical area. So it has to be combined effect by all three of them. In India, of course, there is by private sector. Do you mean the private practitioners and the private hospitals, or do you mean the industry? Just to be clear. No, they are two different things. The industry is different.
So towards the most industrial part, but also the private practitioners as well.
Okay. So I think yes, there is a huge gap, and let me talk about the industry first. So there is a huge gap between industry and the academic research. So industry wants to take up only just a moment. Yeah. So the industry want to take up clinical trials and clinical research, which is focused on their product or their point of view to validate their particular research. They are not really worried about academic research, at least in India. The funding of academic research from industry in India is, at least in orthopedic, which I can tell you, is not at all there. Okay, so it is not at all there from industry side. Funding for academic studies. They do clinical trials and they involve institutes in the clinical trials, but that is like harvesting data, I mean, from the institute and taking it up for validating their particular point of view. There is a great, okay, and this is the industry scenario. Let me talk about the private practitioners, at least in orthopedics. Like I said earlier, much more impactful and higher quality research is being produced by private institutes and private practitioners in India as compared to government institutes and government bodies. So that is clear in my mind from orthopedics point of view. So private sector is producing better quality research and more quantity research also in orthopedics in India. So, I mean, there can be various reasons, like we discussed earlier in the first question where we talked about the MCI guidelines. Private sector is completely independent of MCI guidelines. It does not apply to them. So, but they are inherently and increasingly in last 2 years, they have been producing. So probably I think these are the byproduct of the earlier when 7 years back MCI imposed the guidelines, and these were the same students who had to do and publish the papers once they went into the private sector. And since they were already introduced into the kind of culture of publishing, they could take up these projects and do it better in private sector rather than within the constraints of infrastructure of the government sector. So that is there. So private sector is doing better than the government sector in at least in orthopedic point of view, also in anesthesia, which I can say. Government institutes, I mean, like Sir said, MCI had put up the minimum norms, but those are the only norms that are available. And they have been put up without providing infrastructure, without providing the proper teaching tools to the teachers as well as to the students. Even now, getting many of these government institutes do not have journal access. I mean, that's the basic. Reading is the basis of starting research. And if you're not going to provide a journal access, how are the students going to read and develop the research questions out of it? Isn't it? While if you look at the private sector, many private hospitals have full subscriptions of journal modules. They are investing into it. I don't know till how long or why. Probably it is on the request of the consultants that they are doing it, but they are doing it. So I think there is a need for collaboration. I mean, there is no debate about that. There is a need for collaboration. And the best person to begin with is the clinical scientist coming out of a government institute. So most of the students that are listening to us here, I mean, they have to take the lead in developing their research profile. And over the period of time, they have to look at the MRs coming to them in the OPDs. They have to look at the implant people or the implant companies that are coming to them in their surgical OTs as potential collaborators for doing research. It has to be initiated by clinical scientists at either a private sector or in the government institute, but it has to be initiated by people. Uh, and it should be initiated by government, but I find that I mean it might take longer time rather than individuals initiating it. So that's my take on it.
Okay, so thank you so much. So the next question is for Dr. Vishakha. Before putting out the question, I would really like all the panelists to address the question in a very concise manner because we are running out of time and we have a lot of questions to be addressed as well. So next question is to Dr. Vishakha. We are in need of socially applicable research and I would request you to please talk about the concern.
Okay, thank you. So socially applicable research is, in my opinion, the need of the hour. Now, I had the opportunity to work under Dr. Amit Jain, who is the father of modern diabetic foot surgery. And he has a wing which deals with diabetic foot and its complications. And it's when I worked under him, I asked him why diabetic foot. So I'm just giving this as an example. So he said the reason is because people who undergo major amputations versus people who undergo minor amputations when I'm addressing diabetic foot as the topic, more than the mortality rate, there's a big difference. Like within 2 years, the mortality rate of people who undergo major amputations is 56%. So this is a huge number. And if we take one disease, which is diabetes, which is prevalent in our country, like we have a population of over 1 billion, and around, if we say 8 to 10 crore people are affected, and even 15% of the people undergo certain complications, and the complications are varied, as we know. So imagine the other diseases. So we have other diseases that also can increase the burden. The disease burden of other diseases is also very high, and the morbidity that is associated with these diseases is also very high, and this is such a financial drain for the people who are affected by these diseases, and this can also add an added burden on the government. So first, finding out the trends of which diseases are prevalent, and even simple demographic data regarding the same can have a very huge impact. And like Dr. Ashok mentioned, that even simple demographic data collection can be encouraged at the undergraduate level. This is a very simple study that we as undergraduate students can carry out, but they can really provide great information to the clinicians, and thereby, help in alleviating the disease burden by a large extent.
Okay, thank you so much, ma'am. Going to the next question. Evidence-based practice of medicine need to reach even the general physicians. Can I request Mr. Oshin, if the connectivity issue has been resolved, to take over it?
Hi. Actually, I think I'm still having some connection issue. I give my inputs, but I might not be able to turn on my video in order to reduce the bandwidth required. So, first of all, I apologize for that. And then coming to addressing the question that has been put forward about evidence-based practice reaching general physicians. So it's quite important to understand and realize the time that research work takes to come down into literature that is actually referred to during clinical practice.
I think Mr. Oshin is facing some connectivity issues. Moving to the next question. We have more center studies and there is a lack of collaborative research projects. Dr. Ashok spoke about the same, but we'd like Dr. Vivek Chand to take over this question. Thank you.
Said that, a new concept that is discovered or a new finding takes about 10 to 15 by medical students or by trained physicians or by period is first of all quite important.
All right.
Yes.
Thanks. I know that we are almost at the end of our time, so I'll just make some concluding remarks from my side and also address some of the issues that that you raised and other participants also raised. So, in terms of the first thing that everyone needs to know is that even as we should all understand the value of research, please do remember that not everyone will do research during the course of their career, nor do they need to, So it's really important. So don't feel guilty or don't look at someone with any degree of contempt that they are not doing research. Not everyone has to, as long as you understand the culture of research. That's number one. Second, if you are growing as a physician, medical student, or postgraduate student, the best thing you can do is to find a mentor. Wherever you are, find a mentor that you think embodies the person that you want to be and that the person you want to learn from. Now, a question of funding was discussed. Of course, there are ICMR is not the only source of funding. There are multiple other sources. There are now professional societies. There are philanthropic bodies that can fund research. So look after them. And that is where your mentor your teacher should help you. It's their responsibility to find you funding. It is not your responsibility to find funding for yourself. And as Dr. Ashok said, a lot of research doesn't require a lot of funding, can be done with pretty minimal funding also. So, and finally, failing to get funding is part and parcel of a research career. You will fail 9 times out of 10 in a research grant. So just take it from me. So just because you failed once, don't blame the funding agency or don't blame yourself. Just pick yourself up and try again. And about the other things, I think a number of things have been said. And the last thing I would say is in terms of research, which is what I had said a little bit before also, publication is not the goal of research. The goal of research is knowledge generation. So what you need to do is to find an important research question, right? That's important. That's useful. And that important research question can be a question that addresses basic fundamental biology, or can be of social relevance. So it depends on the skill and interest of people. And if you want to do whatever is the kind of research that you want to do, it's very clear now that you need to be collaborative. You need to do multidisciplinary research. And that's the kind of thing that will also help you grow your own skills, because not all of us can know all elements of research projects. Don't even try to learn everything. For example, all of us don't need to become proficient on statistical analysis. So you take help from someone who knows how to do it. Not everyone needs to learn how to extract DNA from cells. And not everyone needs to know how to do qualitative interviews. So grow your own skills in one area, but one of the best skills that a researcher has is to know where to find help from. Do not be afraid to reach out in case you need help in research. Don't stand on any kind of prestige. So these are a few things that I would like to say. And, with that, I would really like to wish you all the best. And the point that I would like to make also is that in case I can help anyone, or my organization can help anyone, we are available. We do want to work with young researchers. So the organizing team has my contact information. If you want, you can reach them, and they can put you in touch with me. So thanks once again for inviting me.
Thank you so much, sir. Before concluding, we would like to address one last question to you. So there's lack of physician scientists in India, and we would be grateful to know the path to be a physician scientist.
Well, that's a difficult one, but I think I addressed some of the elements. The first thing that you need is a desire that you do want to become one. That's number one. Second, if you do, then seek out a mentor. Seek out a mentor. I think number one, number two, number three, seek out a mentor. There is nothing more important than that, than to find a good mentor. And a good mentor is not one who will just teach you how to do research, but they will guide you on the path to research. And they will guide you. If they don't have the skills, who else to get in touch with, how to help, how to secure funding, how to do research without funding, how to ask an important research question, when to give up trying to chase a research question. That's also important. I didn't mention it before, but one of the things you need to know is when to abandon a path. Don't continue to pursue a path just because you started, and now you will have, what will people say if you give it up and do something else? If something is not working out, don't be afraid to give it up. So, a number of times discussion about private versus government organization was made. I wouldn't indulge in that kind of binary. What you need to do is to find a place where there is an enabling environment. It could be in a private organization, it could be in a government organization. But I think the leaders of those organizations need to appreciate the value of research, need to give some space to the young growing physician researcher scientists, and need to encourage and also give them some motivation and some extra encouragement and some extra reward just because they are doing research that no one else is doing. So I think that is important from the point of view of all the administrators of institutions, of hospitals, of these kind of enterprises. So we all need to do that. And as a young person, what you need to do is just go and find such a place. That's important. We do hope and we do wish that there were many, many, many such places, but unfortunately, that's not the case right now. We are hoping that it will grow, it will change. And from Dr. Ashok's remarks, it does seem like it is changing. So it's all good, and we must work together to make sure that it continues to happen.
Thank you so much, sir. Concluding that, I would like Dr. Ashok to please speak about the same.
Thanks very much for inviting. And like Sir said, I'm looking at it very positively. And I think for research in India, both undergraduate, postgraduate, or doctorate level, it is going to be very good in next 5 years, and we are going to produce very good research and very impactful research in next decade to come.
Okay, thank you so much, sir. Dr. Vishakha.
I think, talking to all the panelists, especially Dr. Ashok and Dr. Vivek and Oshin, it really broadened my perspective on a lot of things that I wasn't aware about, especially when it came to these institutions that were open to funding. And I'm sure, other fellow peers like me who are interested in research will take this up and, not give up, So, yeah.
Thank you so much, Dr. Vishakha. Mr. Oshin.
Am I audible?
Yes.
I'm so sorry for all the notifications. I'll just say one thing which I say to anybody and everybody who asks me about research. There are a number of paths, and you have them. All you need is a desire to do it. To be honest, I haven't got my STS till now. Like my STS project wasn't approved. yet I have managed to somehow complete about 10 research projects. So it's not funding, it's not resources, it's nothing that will limit you. If you're dedicated, you'll be able to do it, and you'll be able to do high quality research. That is my last message to all of the students from listening to us today. And thank you everyone for having me. And I apologize for all the inconvenience on my part.
That won't be an issue. That wasn't an issue. Oshin, thank you so much. We can all reach out to all the panelists if we have any more questions later after this panel discussion. Thank you everyone for joining, and I would really like to thank Dr. Vivek and Dr. Ashok as well as Dr. Vishakha for joining the panel discussion. We really had a very beautiful insight, and thank you for giving us so many suggestions. All the students and research enthusiasts who might have heard this or are hearing this would be very glad to have been joined here, because we did really get beautiful insights. Talking about the conclusion, I'm signing off right now. Would like to sign off as a senior research executive of Rishikesh SM that had collaborated with SMR. Thank you for giving us an opportunity for such a fruitful and healthy collaboration. It was a great event and a very, very healthy discussion. Thank you so much. If Tarun would like to add anything.
Yes, thanks, Fauzia. So I would like to express my sincere and heartfelt thanks to all panelists who accepted our invitation to be a part of this excellent group discussion. And sincere thanks to Team Clinicase for such a wonderful collaboration. And special mention to Dr. Ashok and Vivek sir. Despite of your busy schedule, you accepted and came forward to support young budding students like us. And special mention to Oshin and Vishakha for being a part of the panel. So and all did their part very excellent. So I hope all delegates enjoyed this session. So thank you so much.
Before concluding, I would really like if everyone could take a group picture.
Yeah, I will take. The remaining people also please take if possible. I will just end the live stream. And
Sure.